I'm Dr. Ian Cavin. I'm a board-certified general surgeon, and one of my areas of interest is hernia repair. A ventral hernia, or an incisional hernia, is a hernia in the abdominal wall on the front of the abdomen. Most commonly, this happens through a previous incision, but it can be native to the tissue. This is sometimes a very large hernia, and the robot is very good at repairing these because it allows us to give you a muscle closure, allowing you better function of your abdominal wall. The robot allows us also to get into spaces that are much more difficult to get into with typical laparoscopy. This allows us to do hernia surgery that traditionally has been done with large incisions, which had a long recovery period associated with them. This reduces the recovery period significantly, sometimes from 5 to 7 days in the hospital to maybe overnight or even home the same day.